All right, we're going to get started here. Hi, everyone. My name is Shayla, and I'm the student recruiter for the College of Health Sciences. And today I'm joined by my colleague, Christy, who is an associate teaching professor in the Faculty of Nursing. She's definitely going to share more about herself later on in the presentation here. But today we are going to be going over the after degree program for nursing. But before we do begin the presentation, I do want to just acknowledge that the University of Alberta is located on Treaty 6 territory, and we respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant community. And here I'll have Christy tell you a bit about herself.
Hello, thank you so much for having me. Really happy to be here. Wanted to introduce myself a little bit, share a bit of my story, and hopefully see if anything kind of resonates with you and if your um, journey might look similar to mine in interests and how that might play out. So, a little bit about me. I picked U of A nursing a very long time ago. In 2006, I actually graduated with my undergraduate degree in nursing. It's 20 years this year. It's amazing. But I picked it because I knew that I wanted to work with people. I didn't really know what that would look like or in what capacity, but I was piqued. It piqued my interest in working with people, caring in a caring way. I really enjoyed sciences and the body, just the body systems really intrigued me. So I pursued my undergrad in nursing, and it has taken me on an incredible journey, I have to tell you. So after I graduated, well, there's a picture of me with my hat on. Yes, that was a very long time ago. I started it at pediatric cardiology at the Stollery, and it was a wonderful place to learn and grow and start my profession. Gave me a really solid foundation for nursing care, and pediatrics is fun. I worked in pediatric surgery as well, and I enjoyed peds so much. And I thought, you know what, I think I might try teaching. And an opportunity came up for me to be a pediatric lecturer. And so I pursued this opportunity. And I thought, I like this so much, I think I should maybe pursue my master's of nursing and learn a little bit more about what teaching is about in this context. So um, that opportunity opened other doors for me. So I worked part-time. I continued to work part-time as I did my master's in neonatal intensive care. And I stayed in neonatal intensive care for a very long time. But what I loved, one of the things that I loved about while I was doing my master's and pursuing higher education is that my nursing profession could change and flex with what my life chapters were like, that I was able to do that while continuing to work and provide for myself and be um, self-sufficient in that regard. So the nursing profession has just been phenomenal for my many different chapters of my life, and has opened so many doors for me personally and professionally. Personally, in many ways that I've even done, camp nursing on a volunteer basis. It's just opened so many really great opportunities and doors for connecting with people in many ways that I would have never imagined the doors would have opened. So yeah, here I am. This is a picture of me teaching in the lab. I'll tell you a lot more about that as we move forward. And that's a picture of me in the hallway in the hospital as I was working on a shift. So I'm happy. I'm looking happy. It was really great. All right, we'll continue. So the Faculty of Nursing at U of A, I just want to highlight and touch on that. Our program is highly ranked year over year in Western Canada and nationally for our programs that not only in the research aspect, we have a phenomenal research program, but as well with our teaching faculties that we rank high. And so we really value what research looks like in the nursing context and how we utilize that research to inform practice for nursing. So love that part of it for sure. Thanks, Shayla. So, why nursing? Well, there's lots of reasons. I have many that I'm going to share with you, but some of the very most basic ones are working in a really dynamic opportunities for your workplace. And if you like working with people, there's plenty of opportunities for that. It's really making a difference in lives of individuals, and it's on the daily basis. But the good thing is also if you don't want to work in that context with people, there's so many different avenues that nursing can take you that is, very people focused, and there's other opportunities that are not. So nonetheless, either way, very employable. There's always demand and the variety of settings. I have a slide coming up, but it is just above and beyond even just the usual ones that first come to mind, likely. Um, Even thinking of travel nursing. If you want to travel the world on someone else's coin, nursing is a really phenomenal way to do that, to explore, see the world, and have just incredible opportunities in that regard. So, my thoughts, what I love about the nursing profession. Again, there's me teaching in the lab. Um, I'll tell you all about our lab setup, but it is really exciting to be able to work in that space. And yeah, I thought I was on the phone once, and this was, of course, a couple years ago, and wearing lots of PPE, but um, it's a very dynamic profession. The things that I love about it that first came to mind were, of course, those relationships that you develop with people and with patients and those connections. Um, to me, it is, I can't think of any other profession truly that gets to work with people in those most sacred and vulnerable moments, truly. It is a absolute privilege to be able to see a first breath of someone on this life, right? To be in the room for those moments, and also to be in the room for those moments where it's a final breath of someone on earth. And I can't help but recognize the privilege of that it is very different than many professions. And even within the healthcare sector, it's a very different role than many other professionals. Um, and it's truly a privilege. It is a responsibility, but it is a privilege. And so building those trusting, compassionate relationships, blending science and skill and human connection, advocating for patients and families is a big part of it. Learning, growing, there's always new things to learn. So being a lifelong mentor is also a really great part of it too, that you're constantly learning and expanding um, your skills and abilities too. Mentoring others. Nursing is a team sport, we say, and that's an important part of the nursing profession is mentoring new nurses, working together, sharing insights, and upholding that really high professionalism standard that nurses are known for and ethical care. What I love about teaching nursing, lots of things. So I am an associate teaching professor at the Faculty of Nursing, and I absolutely love working with students on a daily basis. Watching students learn, grow, gain their confidence. Um, it's just a highlight for me professionally now to be in this role. Supporting students as they're developing their own nursing practice. It's a lot of steps to get there, but it's really scaffolded in a way. The learning is to help students gain that confidence and that knowledge in really appropriate steps. Um, Contributing to the future profession of nursing. We are an evolving profession that continues to grow and be recognized for our contributions to the healthcare sector. And seeing moments where it truly clicks for those students, they have those aha moments, is just really the icing on the cake for me as an instructor. I love working with students in the clinical setting. I'll tell you a bit more about that soon, but it truly is hands-on learning in a hospital or an acute care setting, um, which is pretty high stakes at times, right? Like it's a lot when you're dealing with real patients and you're learning and you're growing, but to have that support of an instructor and for me to be in that role and my colleagues too, I know feel the same way that it's a privilege for us to walk alongside students in that because um, everyone knows what it's like to be a learner and it can be challenging sometimes. So to know that you have that support in a clinical instructor and in those faculty relationships is really important. And so we value that. And what to expect in the after degree program in nursing. So a very, very high level breakdown of it is expecting some theory courses, there's clinical courses, and there's lab courses. And many of these will all happen simultaneously. So you may be in a theory course, so a couple theory courses for several days a week, and you might have a couple days of clinical. So as your semesters progress and you continue through the program, you will advance in your clinical courses in both time of courses, so how many hours you spend in the course, and then also, of course, with increasing in your responsibility and your independence, so appropriately. So, kind of just as I mentioned before, things are really well structured to help support you throughout your growth towards independent practice. Okay, thanks. Um, it really does, the program really does leverage the students' unique talents. So we recognize that, especially as after degree students, you bring so much personal experience with you. You bring your previous education, you bring your life experiences, and all of that is valuable and unique and important. And so we want to utilize that. We want you to have a really great starting point with all of that you're bringing and to just be able to continue to grow from that. So we really do recognize that each individual is unique and brings something to your nursing practice. Um, Kind of mentioned all this previously too, that there truly are a wide range of opportunities available to you. The after degree program, it's great that it's a fairly condensed program. It will be busy for sure because it's a condensed program, but it's really nice because it helps you get to your goals faster. So that's one of the great things about the program too, is that you will move through it in a very systematic way that's well structured to support your growth. So a little bit about our center and where the learning happens for in our program. So the lab learning, we have several labs that are within our faculty building, and it provides opportunities for learning that is looks like a hospital. We have a world-renowned um, simulation center and our lab nursing center. And faculties from all over the world come to see it to see how they can set up their own labs and simulation. So it's pretty great that we have this for our use. But the labs work in conjunction with your clinical courses. So as you learn skills in the lab, you are then able to implement those skills in the clinical setting. So it just continues to grow and scaffold your learning. And it really is an immersive experience. So it's great to be able to have very structured learning with all the lab equipment that you would need, whether that's learning, giving injections, or if we're talking about IV therapy, we would have all the supplies in the lab for that learning experience. And you would have the theory, you would do the lab component, and then after the lab, you would be able to do that skill in clinical. So that's kind of the breakdown of how it works. And then for each course, clinical course, there is a high fidelity simulation included as well, which is pretty fantastic. So high fidelity meaning there is a computerized patient. So that's what this picture looks like right here. So this is one of our faculty members that's controlling the patient who has, respirations, they're breathing, their eyes are blinking, they have pulses. The simulation operator can speak for the patient, and we have monitors there. It really is a phenomenal setup for the hospital. And the purpose of this is to have opportunities that are low risk, right? There's no risk for patient harm in any way. It's a phenomenal learning opportunity where students can take learning risks to think critically in the moment. What could I do? How can I assess this patient? What is happening, with this patient? And the simulation operators really do set it up well. So there's um, catheters. There is IV infusions running through this patient. It is as real as can possibly be in this type of learning environment. And it just really affords the opportunity for learning in this sense with support. So your instructors are also watching part of this. And the biggest learning comes from the debrief after, where it's a discussion of how do you think that went? What went well for you? If you could have the opportunity to do it again, how would you do it differently? That's where the learning comes into place where we can really unpack um, how things went and the decision making. Think that's the biggest part that I want to highlight for our program is the decision-making capacity. There are, lots of skills. There's lots of things, tasks that nurses do and learn how to do and learn how to do really well. But one of the biggest things I think that separates degree nurses, perhaps from others, and even collaboratively within the healthcare professions, but nurses are trained to be critical thinkers. So it's not just obtaining vital signs. Anyone can put on a blood pressure cuff. But what does that mean? What does this mean in context of the patient's history? What does that mean in context of what else you're seeing in your assessment and your vitals? And how are we putting this bigger picture together physiologically to anticipate what's happening with this patient? So it's a pretty great facility for us to be able to do that, and it really is ultimately to provide a safe and supportive learning environment. So it's great. I love working in the Sim Center, and the team is amazing in there. For clinical, uh, this picture right here is another picture of our lab. So this is what it looks like. Um, In clinical, however, there is a 1 to 8 instructor to student ratio. So this facilitates that you always have a instructor with you that is your support, your guide, your mentor. 1 to 8 students, it might seem like a lot, but thinking of this in context, say in a hospital environment, that there is also nurses that work there, that is their daily role that they're experts in. And so to have the support of the nurses at the bedside, and then the clinical instructor really helps to oversee care. So it's a big team effort, but it is a phenomenal opportunity for students to really be immersed in care. And as I mentioned before, it really is scaffolded well to start with basic skills, assessment skills, really honing in on those very important foundational knowledge and skills, and then building up from that. Um, and then the very last clinical course in the program is where a student would independently be paired with a nurse preceptor. So not a faculty member, but a nurse that is out working in any different number of placements. You could be placed in pediatrics, you could be placed in the OR, you could be in the emergency room, anywhere that nurses are students could be placed, and it's a one-to-one with a partner for your very final clinical course. And that you work alongside that registered nurse in a capacity of whatever they're doing in their normal role, you are going to start working with them and assuming that role with them. And by the end of that clinical placement, then you are ready for independent nursing practice at a grad nurse level. And so it really equips you well to to do that throughout the program. Um, Clinical placements are just a phenomenal opportunity to really experience patient care in a very well structured and supported environment. So the way that this program is set up really facilitates support well for students. I won't read these testimonials. Um, you can certainly read them for yourself, but um, there are a few different programs that I just want to highlight. So there is an honors program, which just has a research component to it that you would be partnered with a faculty mentor. And if you have any interest in research, that could be a really good avenue for you. And then just to highlight another opportunity. So rural nursing is a very unique type of nursing role in that it is often an expanded role as it is in a rural placement. And so sometimes there is less resources available to nurses. And so they have a much a fuller scope potentially and often see a greater variety of things in those smaller areas. So you could have, if you're in a rural emergency or you're in a rural, I don't know, public health site, you would see a whole different variety of things, a much wider variety than if you were in an urban center that had a focus on orthopedics, for example. So they always say in rural, you never know what's going to walk through your door, right? It could be an emergency, it could be something cardiac, someone could come in, um, you know, giving birth. So rural is a really unique opportunity, and some students really do take that opportunity. They perhaps have family or friends that live in a rural center and they're able to live with them for their final placement. And that's how that becomes facilitated for that rural focus. So that would be near the end of the program that you would be able to have that as part of your focus. And then just wanted to highlight on some of the opportunities. So there are so many different places that you can work. And one of the other great things that I love about nursing is that you can change. So your nursing degree can open up all of these opportunities for you, not just once, once you graduate, but you can work somewhere for quite a long time and say, you know what, I think I just want to change. Or you try something, you say, I want to try something totally different. And your nursing degree will open up those doors for you. So here's a long list, but it's just some of the opportunities that are available and maybe some that you never thought before. Or even education, considering, this is my nursing practice now, is as an educator, or research. And okay, I had to add on there, the sky's the limit, but is it? So when you think about opportunities for even stars or medical evacuation, air ambulance, I have friends who have worked with insurance companies and travel all over the world to bring patients back to Canada for healthcare. So truly, it is just the opportunities are endless. And even within those places are so many different roles within nursing, um, even to management, for example. So the nursing degree um, opens up significant doors, even even without advancing to further education, which is always another opportunity if you want to pursue that um, as well someday.
Amazing. Thank you so much, Christy. Now, you've all kind of heard like what the program is like and some very lovely experiences. Now I'm going to kind of go into what do you need to actually get into these programs. So, as you know, we do offer just the regular stream of the after degree program. This is for students who already hold a recognized undergraduate bachelor's degree. It can be from any institution as long as it is recognized by the U of A. With this program, it is accelerated, so it is only 2 years in length, but it is a full-time program. Unfortunately, it's not really possible to do this program part-time. It is a fully full-time program, as Christy had mentioned as well. And it is only offered on our North Campus in Edmonton. With this, we have these very specific requirements. So as I mentioned, you do need a bachelor's degree. Unfortunately, if you only have a diploma or certificate, you will have to obtain a bachelor's degree to apply to this program. The minimum GPA required, so the AGPA is a 3.0. This is just the minimum GPA. We do have competitive averages that I can share later as well. And with this program, we do ask that students complete these prerequisite courses. These are the foundational courses that you would take in your first year if you were to do the 4-year program. So that's why we want students to take these as the prerequisite courses. So you would have to take 3 units of an English class, 3 units of a statistics class, and then these specific courses you do have to take within 5 years of the program start date, and they do require a specific minimum grade of a C+. So that is human anatomy, human physiology, and then medical microbiology. And then just for anyone wondering, your English and stats classes, they don't have a timeline requirement on them. So if you've taken them 20 years ago, as long as they are transferable to the U of A and you have a minimum grade of a C minus, you can use those courses. So there's no like heavy restrictions with those courses, but the anatomy, the physiology, and the medical microbiology do require that 5-year timeline and the C plus as well. And then as Christy also mentioned a bit about our honors program, we do have the honors stream for anyone interested as well. This program has a bit of a higher GPA required, so students have to hold a 3.5 GPA or higher for this program. It does allow students to get more into that research aspect of things, so you kind of get more of that research skill building, you can build more networks. It can prepare you for graduate school as well if that's something you're interested in. And as she also mentioned, you will be mentored by and supported by a faculty of nursing researcher. So that is a great aspect as well for in terms of having building networks. And this as well will take 2 years, as same as the regular stream of the after degree program. And it does allow you to carry out an honors research project as well. So if you're interested in research, this is definitely a great program to look further into as well. And as for the Casper test, this is a specific admission requirement. Students do have to register for this exam. You will have to register for it on Acuity Insights. Again, I can share a lot of this information once we're done the presentation here, but you will have to register on that website. The U of A itself does not administer this test. It is through Acuity Insights. But essentially what the Casper test is, it's a situational judgment test. It's roughly about 90 minutes to 110 minutes. You would take it online on a laptop or a desktop, and it is an open response situational judgment test. Your application will not be assessed until these test results have been received, and applications are assessed on a rolling basis. So I do recommend if you are ready to apply, apply right away and then register for your Casper shortly after, because then your application can be assessed after the Casper test results have been received. And then just for anyone who is an Indigenous applicant, you are not required to complete a Casper assessment. They are currently open. They've been open since September. But the last assessment available for anyone to take is May 5th, 2026. So that'll be the last day that you can take Casper if you are interested in applying to the after degree program. I do recommend though, try and take your Casper sooner rather than later, because then you can be assessed sooner as well. And if you are ready to apply, you can apply. The best place to apply would be directly on our website. uab.ca/apply is the best place to go. Applications are currently open. They have been open since October 1st, and they will close March 1st. So that is the last day that you can apply to the program. Um, and I do recommend that you apply in the year that you will be completing your prerequisite courses by the end of the winter term. So if you still need to register for the courses or you haven't taken any yet, I would recommend probably waiting a year and completing those courses just because there is kind of a tight timeline, especially right now if you were to apply. The document deadline for this program is June 15th. And when I'm talking about document deadlines, that means all of your official transcripts, your prerequisite courses, Casper, and your proof of degree. So you'll need to make sure, and English proficiency as well. Um, Again, I can send a lot of important information for anyone who needs help with the prerequisite courses and things like that, but all those specific documents need to be sent by that June 15th deadline as well. And here's some steps for how to apply as well. So with this program, as I did mention, you will have to apply to our main campus. We do offer we have 3 campuses in total, but our after degree program will be on our North Campus. So make sure that you are selecting that campus when you apply. And we do have tons of programs to look at. So feel free if you're looking at other programs as well, uab.ca/programs is the place to go. But if you're pretty sure you want to apply to the after degree program, you can select that program as well. And just so everyone is aware as well, I do offer advising. So if you have any questions that you want to go over after the session today, feel free to book a virtual advising appointment with me, uab.ca/advising. And then if you want to check the competitive averages, I can send this in the chat when we're done here as well. uab.ca/averages. This will kind of show you the historical averages we've had for the past 3 admission cycles, just to give you an idea of like where the competitive averages are sitting. And this is also a great place for everybody to go as well. uab.ca/on-demand. I do have a Casper information session uploaded there. So if you want to learn more about Casper itself, there is a video on there that has a lot of good information about how to prepare for the Casper, what the Casper is, and things like that. I'm also doing another info session in February if you are interested. Again, I can send all those links after we're done here, but feel free to take a screenshot, save these links, whatever you need to do if you are interested in going to these links. And as I mentioned, we do recommend you apply early. Applications have been open since October 1st and they will close March 1st. So I recommend getting your application in as soon as you are ready to, before that March 1st deadline. And if you are interested in scholarships, we still have scholarships available for transfer applicants. So uab.ca/awards is the best place to go for scholarships. These will close March 31st, 2026. So please feel free to submit those scholarships whenever you're ready to before that deadline. And then just to give everybody a bit of an idea of like how you will be evaluated. So again, you do have to have a bachelor's degree from a recognized academic institution, and you will be evaluated on your AGPA. So this is the most recent 24 units. So the most recent 8 classes you've taken, those are going to be assessed for the AGPA. And you do need a minimum GPA of a 3.0, as mentioned. But yeah, it's not your whole degree that's being assessed. It's just the most recent 24 units that will be calculated for your AGPA. And then I do recommend whenever after you apply, you will get access to your Launchpad. This is where your application will be housed. So please keep checking your Launchpad. It never hurts to check it once a week or twice a week, whatever you need to do. Anytime there's an update, you will be notified about your application. It's always good to go to this website as well, uab.ca/launchpad. This will show you exactly what your status is on your application. If you have anything that you need to submit, you'll be given like a nice little checklist. If you have check marks on everything, that means you're good to go. But if you have any X's near any action items, that means you'll have to submit something. But once you apply, you will be given access to your application and your Launchpad. And then after you do receive an offer of admission, again, you will see this in your Launchpad portal. We definitely want you to accept your offer. It is very important to read your letter carefully because it'll give you the conditions you need to meet to maintain that offer. And if you are given an offer, most students will have a deadline of May 1st to accept it. But if you're given an offer later on, you might be given a different deadline to accept your offer. And you will need to pay a non-refundable tuition deposit to secure your spot to let us know that you're planning on attending. And this tuition deposit will go towards your fall tuition. And then once you've accepted your offer, you will have access to start planning your courses in the springtime. Again, this isn't something to worry about right this moment, but if you do get accepted, usually in about March and April, you can start registering in your courses. I will also be hosting some Registration 101 workshops to guide you through the registration process and help you select the right class for the program. As Christy was kind of mentioning, this program is structured quite nicely. So it's quite laid out for students very nicely. So it'll show you exactly what you need to enroll in. Like there's not a bunch of extra options you need to select. They're very specific with what you need to take. So that's really nice. But if you do have any questions about it, again, I'll share my email here, but uab.ca/reg101 is the best place to go if you're looking for more information about class enrollment. Again, that won't come right now, but it will come in like the next few months here. And again, I definitely recommend checking out this website as well. Please keep checking your Launchpad for any updates made to your application. Never hurts to check it again once or twice a week if you need to. And this is a great website as well for learning how to accept your offer, when you require final transcripts and things like that. uab.ca/aft app is the place to go. And then lastly, if you do have any questions, we do have about 20 minutes for questions right now, but if your question doesn't get answered or if there's something you want to email me about personally, please reach out to me. My email is nursing.recruiting@ualberta.ca. Or if you just want to check out our nursing website in general, uab.ca/nursing is the place to go. We have all of our programs listed on that website as well as some more information about our faculty in general. So please feel free to check that out. And if you do want to sign up for more information, event alerts, and updates, you can scan that QR code there. But thank you all so much for joining us today. If you do have any questions, we do have this little Q&A function there. I do recommend that you write your questions in there, and then Christique and I can do our best to answer the questions that you may have. Thank you all so much for coming today. I'm just going to leave my email up here in case anyone needs to write it down or take a screenshot or whatever, but I will start looking at the questions that you guys have for us here. Ooh, maybe Christy. Can you see the questions? Perfect. Do you want to
I
answer
can.
that first one? Okay, awesome.
Yeah, for sure. So I'll start with EMS. So if you think that you like the idea of being in an ambulance and being that initial point of care for patients, that might be something that you would pursue. It's very different from the nursing role. The timelines are much shorter that you would encounter patients, and it is really just transport in that regard as that initial first care and transport to additional care. Uh, Different than a physician for sure. So nursing is different from medicine in that it is a different scope of practice, certainly a different educational route, but a different scope of practice and different, I'll say, focus on decision making. So physicians would have a primary role in diagnosing, prescribing, um, a focused on the disease process, that type of aspect of it for a role. Whereas nurses, certainly complementary that we need each other to function well and work very closely together with physicians. But nurses, the care of nursing it is more emphasized on holistic patient care. Nurses' role is very different, that we are continuously monitoring, continuously assessing. We are implementing care. We are working closely with physicians to express our concerns about the patients and then work together to coordinate care, consider treatment options. It's maybe not as hierarchical as many people would think. It's really collaborative. Um, so yes, and different in scope too, that my scope of practice as a registered nurse is very different from a physician that physicians are trained to do other things that would be in a wider scope of practice with increasing responsibility in that regard too. So different, but very collaborative.
Awesome. Thank you. I think a lot of these questions seem to be admission questions, so I can definitely answer a lot of these. Um, yeah, for anyone kind of wondering about the prerequisite requirements and whether you can be considered even if you have one left over, yeah, that's totally fine. Like as long as you have the prerequisite courses completed by June 15th, you can definitely be considered for admission for sure. Just to keep in mind as well, like your application won't be assessed just once. So if let's say you get evaluated before your prerequisite courses are completed, it is possible to be reevaluated if needed once those courses are completed later on. So yeah, applications don't just get looked at once. They usually get reviewed, I would say at least 2 or 3 times, depending on the applicant as well. But yeah, as long as you have those prerequisite courses done by the June 15th deadline, you definitely can be eligible for the program. But if you're getting them done, let's say in the summertime, you may not be eligible because you wouldn't have them done by that timeline. And then for anyone who's wondering about the prerequisite courses, again, trying to get them complete before the deadline, I would say if you only have to take like 2 courses, it may be possible to take them in the spring term at the U of A only. I can't guarantee that they will be accepted taking them outside of the U of A just because we can't guarantee we'll get your application or sorry, your transcripts in time. But if you need to take all 5 prerequisite courses and you still haven't enrolled in any, the deadline is June 15th, so I think it would be really hard to get those completed. And I do recommend to like it's not I think it's recommended to take your time to actually complete those courses because they can be used towards your AGPA. So if you're trying to rush 5 courses, sometimes it may not be the best. So I just recommend if you haven't taken any of the courses and you still need to, probably would be best to try and take them over the next cycle and then apply next year if you can. But again, if you only have like 1 or 2 courses that you need to take, you can take them in the spring term at the U of A through Open Studies. Please keep in mind too, Open Studies is only a part-time program. Any, you can't take it as a full-time student. So the most you could take is only 2 per term. So again, if you need to take 2 classes, 1 or 2 classes, I think that's definitely achievable in the spring term. But if you need to take more than that, the deadline to like take courses in the winter has already passed. So it would be recommended just to take your time and then apply next cycle if you can. Um, if you have a Bachelor of Science in Industrial Mathematics, it definitely depends where your degree is from and what courses you have taken. So I would recommend if you want to email me and if you want to tell me some of the courses you've taken, I can definitely look into that further. If they are international courses, though, you will need to apply and be assessed, unfortunately. But if they're taken within Canada or in Alberta, I can definitely have a look and help you out there. So please feel free to email me if you have specific questions about courses that you're wondering about if they'll work or not. Again, if they're international, you will have to apply and have them assessed, though. Just to reiterate too about applications being reviewed, they are assessed on a rolling basis. So that means they are assessed once they come in. But with nursing, it's a little bit different because they do require that CASPER assessment. So your application won't, like, let's say you apply in October, but you don't do your Casper till February. Your application won't be assessed until that Casper test gets received, like those results are received, because that's one of the first things that they actually look at in your application. So it really depends when you've applied, when you've taken your Casper test on that timeline. But again, the faculty tries to assess you more than once. So it just really depends on the timeline that you've applied and you've completed your Casper test. But sometimes if they need to, again, they will wait until all your courses are in and then evaluate you again if they need to. Um, Sorry, I know it's not the most direct answer, but it really is situational. It's based on, when you've applied and everything like that. But if you have everything in, like if your checklist is complete and you're just waiting, I would hopefully, I would hope that you would hear back sometime soon. And then, yes, English as a post-secondary level course is required for admission to the program. So if you've taken like an English literature course or like English writing or things like that, those courses are typically recognized for admission. And a lot of students also wonder about like the ELP requirement. That is separate from the English class. Like we know that you can speak English, but you do have to have a English class as part of that requirement as well. Awesome. Maybe this is a good one for you to answer.
Yeah, I think this is a great question. What are some good qualities to have as a nurse? I think I want to really highlight that anyone can become a nurse. We don't need to have this, quintessential who is a nurse, who should I be if I want to pursue this? That I think diversity of who is coming into this profession really strengthens our profession. And there really is something for everyone. It doesn't have to be a prescriptive way of a what to follow and what you are ultimately going to look like as a nurse. That I think anyone with any sort of interests or whatever qualities you bring, you can find a space for you in nursing. That it is not we're not in a box. So I would say that it's for anyone, and that we really teach you um, how to be a nurse. But you are you. You can be a nurse no matter what you bring into it with your qualities. And we teach you the clinical judgment. We teach you adaptability, organization, knowledge, skills. So long as you come with curiosity and willingness, um, everything else is teachable.
Okay, awesome. Yes. Okay. So for anyone who's wondering about like the English language proficiency or the spoken English language proficiency, this is required for our nursing program just because students need to be able to read, write, and communicate in English proficiently, especially since you are going to be working directly with patients and other faculty members as well. This requirement means that either if you have 6 years of education in full-time English, you will meet this requirement automatically through the submission of your transcripts. But if English is not your first language and you have less than 6 years of education in English, then you will need to write an exam. I can share a link here for more information on that, but essentially you will have to write an English exam if you do not meet those qualifications for that proficiency. If you have anything you want to add to that, Christy, definitely you can. I can answer that one first, though, if you want, unless you have something you want to add to that.
This next question we're talking about right now
Yes,
for
yeah,
med school, yeah.
yes.
Um, sure. I think I've known many physicians who their undergraduate degree was in nursing, and I have heard resoundingly positive feedback from that perspective, that it gave them a nursing perspective. It's a different type of perspective and gave them a really solid foundation in patient care, in pathophysiology. So absolutely, it is a very good transition that I have heard from anecdotally from many individuals and many colleagues that I've worked with who are physicians.
Amazing. Something I do just want to add to that, like I definitely have also heard great like not reviews, but like great success with that. But I also want people just to be aware that like with medical school, You can literally do any undergraduate degree. You do not have to go into nursing, but if you are interested in nursing and you want to become a nurse, I definitely recommend doing that pathway. But if you're not 100% sure about nursing, like if you don't know if that's really your thing, just know like you can literally do any undergraduate degree and you can apply to med school. Like I've known people who've done a Bachelor of Music and now they're anesthesiologists. So like there's so many ways you can get into med school. Like nursing isn't the only way, but if you are really interested in nursing and you want to become a nurse, then I definitely recommend that. And then for anybody who is wondering about how like the AGPA is calculated, especially with their prerequisite courses, if you have taken the prerequisite courses in your most recent 24 units, so the most recent 8 classes you've taken, if some of your prerequisite courses fall within those, then those will be used in the calculation of your AGPA. If you've taken your prerequisites like a while ago, most likely they won't be included in that AGPA calculation, but they will still be like double checked to make sure that you have completed them for the prerequisite requirement. And then, so your bachelor's degree, I would say if you were in the last year of your bachelor degree, then you can definitely apply. But if you're still in year 2 or 3, you would have to wait at least the next year, the 2 years after to apply to this program, because you have to have your proof of degree by the document deadline. So like, let's say currently if you're in your fourth, like let's say I'm a science student in my 4th year of my program and I want to apply this cycle. You definitely could do that because I would be done my science degree by June. But if you're still in your 2nd or 3rd year of the program, you would have to wait at least a year or 2 years to apply to the program, or you have to have your full degree as well. But usually I recommend you being in your last year of your program to apply to this program.
But that being said, Shayla, I also just wanted to add that that's just for the after degree program,
Yes.
that there you could apply to the baccalaureate, the undergraduate collaborative program, I'll say,
Yes.
if you don't have a previous degree.
Yes. Yeah. Then you would be considered just a transfer student for that program. So yeah, just for after degree, you need the degree, but like Chrissy said, for the other nursing programs we do offer, you can still apply as a transfer student. Perfect. Thank you for catching that. If you have a degree, then a diploma, will they consider the courses in both programs for the 8 courses used to calculate the HGPA? So they will use the most recent that are transferable. So like if you've done your diploma after your degree, they most likely will look at what's transferable from your diploma first and use that in your AGPA calculation. But if they need to go back to your degree, they will then do that if they need to. And that goes the same for anyone with a master's. So like let's say you did your undergrad degree first and then you did a master's. If you have master's courses that are transferable to the U of A, they will look at your master's program first. And if they need to go back to your degree, they will. But again, they're only looking at the most recent 24 units that you've taken. Sometimes it can be extended to like the 27 or 30 units. It kind of just depends how many courses you've taken in your last semester, but it usually can be up to between like 24 and 30 units can be used for the assessment. And yes, just to confirm again, if your prerequisite courses are still currently in progress, like you're going to have them done before that June 15th deadline, then they will definitely be used in the AGPA assessment because it's your most recent term that you're taking. If you are taking a spring term, again, only at the U of A will they accept this, then those will be used as well. But if you're currently taking courses in this winter term, those will be used in that AGPA assessment because it's your most recent term that you're taking. Hope that clarifies some things. I am going to send a couple of links I think would be important for people to have access to before we are done for the night here. Just going to stop sharing my screen. I'm just going to share the after for anyone who needs to still take the prerequisite courses, or if you're planning just for the future to apply to this program, this is a great website that we actually have here. All of these courses will meet the requirements if you take them on the website here. This is the after degree prerequisites website. It is a great website. It has, and it's updated quite usually, like I would say twice during an admission cycle if needed to, just so we can keep up to date with the courses that you can take. And then you could also use the transfer credit search tool, especially if you're like outside of Edmonton. There are lots of places that you can still take the courses outside of the U of A. Um, And this will give you kind of an idea of like if your courses are transferable to the U of A or not. Again, if they are international courses, you will have to apply and submit course descriptions for those to be assessed. And then for anyone wondering about like the language requirements for like the English spoken, or sorry, the English language proficiency and the spoken language proficiency, this is the web page that'll give you more information about how to meet those requirements. Yes, as I mentioned, applications are assessed on a rolling basis, so it is possible for students to be offered admission as soon as that Casper test comes in. I won't be able to share how many have been sent out, unfortunately, as recruitment doesn't have any involvement in the process of the applications being or the offers being sent out. But yeah, there have been offers that have been sent out, I believe, as well. But again, students can be assessed until the summertime, so it is possible to be offered admission later on into the application cycle. Oh, yes. Okay, this is a great question. For course descriptions, there's actually a specific way that they want you to write them out. It is quite straightforward how they want you to write it out. You can write it out yourself. And this is for anyone who is an international applicant. I will send you the web page here as well, just to give you an idea of like how to send your transcripts, how to send course descriptions, and things like that. If you're applying to our collab program from high school, you don't need to make sure they're all done before sending your transcript. You can send like course and mark update forms. I will send that as well. I know there's tons of links here, but they are super, super helpful. But yeah, for like high school, usually your last transcript will come in after you're done in June, but you can submit your updated course marks on your application here. I'll send that as well. I do recommend if you do have official transcripts ready to go, it is better to send them sooner rather than later. Um, Usually they will need them for like a final assessment if required, but it is better. You can send copies if you want to, but I do recommend if you can get access to them and send them officially, that would be best. But you can upload copies if you just want to show them what classes you're currently enrolled in. And unfortunately, we are at time here, but I will share my email if anyone has any pressing questions that you want to ask. Feel free to email me and I can help you with any of your questions here. But I just want to thank Christy so much for providing a lot of her insight. It was so wonderful to hear from someone directly from the faculty, and has been with us for quite some time now. So yeah, I just want to thank you so much. It was great hearing all that information from you. And I want to thank everyone for
Thanks for
coming
having
today.
me.
I hope it was super helpful for everybody and very insightful. Awesome. Well, again, thank you so much again, and I hope you all have a great night. Bye.